Welcome back. We're going to get started on our final session for today. This is the second day of our three-day conference, the UCP Conference on Latinos with Disabilities. We're going to be addressing the topic now of language access and disabilities, and particularly in terms of the kind of challenges that families face every day. Part of the impetus for this, of course, is that a couple of our panelists today deal with these issues on a sort of day-to-day basis as they do outreach in the community. And oftentimes, at least in their cases, they're dealing with Latino populations, but other populations as well. So what I'm going to do is start by introducing our guests one at a time, having them each start out with a kind of overview description of the work that they do and the work that their organization does in these different regions of the country. And then we'll get into more of a kind of a hands-on discussion about the kinds of challenges that they face day to day. Let me get started. If you want to turn your cameras on, Karla and Dr. Rosa. Let's see. All right, here we go. Let me see. Hello, Karla, can you hear us?
Yes.
Okay, great. If you, okay, I can see you and I can hear you now.
Okay.
And Dr. Rosa is joining. So you're a little bit low, Karla, so you might have to speak up in terms of the volume if you have an adjustment there as well. We're also waiting for Doris Maldonado. Give me 1 second. As soon as we get started, I will try to reach out to her as well to make sure that she's coming on. She's with the Council on Disabilities in Connecticut. So let's begin first. Karla, if you could start out by introducing yourself and talk about the work that you have been doing. You and I met sort of through your organization, United Cerebral Palsy of Huntsville and Tennessee Valley, which is one of the affiliates of the United Cerebral Palsy Network. We connected on the kind of work you're doing day to day. I know that you're originally from Mexico and that moved to El Paso, I believe, and then eventually made your way to where you are now doing the work you're doing. Talk about, first of all, your position, what you do day to day, and then I'd like to get a little bit of background about your own history, because I know you have children with disabilities. So if you could begin, please.
Yes, I do. Well, first of all, I want to express my gratitude for the warm welcome. And I would like to send greetings to all of our viewers. Thank you for being here with us. And yes, my name is Karla Greene, and I work for UCP Huntsville and Tennessee Valley here in Alabama. And I'm the interpreter and community outreach specialist. So I work with all of our Spanish-speaking families here in our area. And as you were saying, yes, I'm Mexican. I was born in Guadalajara, Jalisco, Mexico, and I was so fortunate to grew up in the border, El Paso, Texas, and Ciudad Juarez, El Paso. So I'm familiar with immigrants and language barriers. I'm a mother of 3 girls, and my twins are on the autism spectrum. So I have received services. I've been on both sides of the fence as a parent with kids with different abilities. That's what I like to call. And now as a provider with interpretation and translation. But I don't like to see myself just as a translator, because our whole intention is to support and communicate to our families, for them to understand the importance of the services, and also for them to understand how to help their kids to reach their max potential. So I work for early intervention services, as well as outpatient clinics, and any other program that they need me. We have respite services too, so to inform families about what is respite and fill out forms. I mean, I'm there for everybody that needs me in the organization here in Huntsville.
That's fantastic. Tell me if you can, when did you begin this particular position? Because I think it's a new position for UCP.
Yes, it's a new position. I started a year and a half ago here at UCP, and it was actually something that I was waiting for. I think this opening was just for me. As I said, um, me being a parent of kids on the autism spectrum, I'm so involved with therapies, speech, OT, PT, ABA, IEP, meetings. So I have experienced everything. So on my part, I wanted to do something for my community, the Hispanic community, Latino community here in Huntsville. As you say, you think about Alabama, well, you think about not
You think of the
Hispanics,
South.
right?
You think of the South. Yeah, you think of Alabama. You think of the
Yeah,
South.
yeah. I mean, but we have a community of Hispanics and Latino families here that we wanted to reach out and offer our services, because as every other family that lives here in the United States, they have the right to get the services for their kids. And as a mother that I have experienced the improvement and the work of therapy with my own kids, I mean, I was just blown away when they offered this position to me. So it's very close to my heart. And of course, I want to connect with them. I want them to see that I look like them. You know, we have the same culture, because I grew up in most of my school years were in Mexico. And then I moved to El Paso, Texas. I went to UTEP, Gold Miners. And that's where I learned the language. I mean, I have to go through several classes, ESOL classes. So I know the feeling of learning the new language, the struggles of like dealing with the system, the health system, the school system. So I was just so happy that they gave me the opportunity, and also was happy that they were trying to reach my community. I mean, not a lot of organizations, they have the intention to do that. And they opened this position and they're paying me to do this. So, I mean, yeah, I'm just grateful.
I'm glad you raised the point about, and this is vital, I think, in almost any kind of service that's being delivered to the public when you're trying to address a segment of your population who may be monolingual Spanish or some other language. It's not just as simple as translating things, right? It's just not that simple. There are all sorts of cultural questions that arise, and context, and in your own experience raising children on the autism spectrum as well. I'd like to, for a moment, go to Dr. Irma Rosa. Dr. Rosa is a Senior Director of Therapy Practices and Coordinator of Clinical Education at the University of, at the UCP of Central Florida, another one of our affiliates, one of our larger affiliates here in the country. Dr. Rosa, talk about your role first broadly with the organization, and then maybe tap into the subject matter that we're trying to address in this panel.
Good afternoon, everybody. Thank you for inviting me. My name is Irma Rosa, and I'm a proud Puerto Rican. And I love my accent. I'm not ashamed of it. And I think that's extremely important. Like Karla said, we need to be proud of who we are. My position as a Senior Director of Therapy Practices for UCP of Central Florida basically is I oversee PT, OT, and speech that you are very familiar with. And we have about 102 therapies in our system. Then obviously we are going to provide all those services to our clients. And in our particular program, we treat children or individuals from 0 to 21 years old, and we have from babies to where they are transitioning to adulthood. And within those services, we also provide a schooling. We call it SET, S-E-T, because it's support. It's going to be education, and it's going to be therapy. And we try to integrate all of them for the benefit of the families, because a lot of times the struggles that they have is like the school is in one place, the therapy is another place, and then for counseling, they need to go to another location. And our intention to create this system was to have an umbrella of services that will be comprehensive and congruent to the needs of the families in one particular location. And so far, that has been something that they have embraced. As you mentioned, Karla, you speak my language, as you were mentioning, the struggles that people confront when they sound different, look different, and different socioeconomics or ethnic backgrounds, because even that we are Latinos, sometimes coming from different places, we don't even have the same language. And I think that sometimes for people that are not in our culture, it's difficult to understand.
And the makeup, I'm going to come back in a moment to kind of the makeup of the populations that you're dealing with specifically, but let me first introduce our third guest for today. Our third guest is Doris Maldonado. Doris, thank you so much for being with us. Doris will also be our keynote speaker tomorrow afternoon, just a heads up on that, but she is former chair of the Connecticut Council of Disabilities and has a long resume dealing with disability issues, advocacy, work in the Latino community, and in Connecticut and around the country. But thank you, Doris, for being here. If you could talk about your work and your experience and how it's touched upon the topic of this particular conversation, the language barriers that happen sometimes with regards to access to disability services.
Well, thank you, everyone. Buenas tardes. Gracias, James and UCP and our distinguished panelists and allies and comunidades for having me. That's a very long answer to a very short question, but
we have a little time. We have a little time today.
Yes, thank you. This has been my lifelong journey as a linguist regarding language access. Yo soy puertorriqueña también. And it's not only been for the judicial and educational national compliance that I'm working with language access, but medical providers. I am a person born with disabilities. And I'm a parent of children with disabilities, and I teach and advocate, and I'm a guardian ad litem for children with disabilities. So working with families families of children with disabilities, with special health care needs has been my passion. Now, currently, for the past 2 years, I'm working on a 3-year project as the project advisory committee lead for federally funded project for Family Voices National, promoting equitable access to language services. So I've been working directly with the Office of Minority Health, the American Academy of Pediatrics. Now I'm part of their faculty, thank God. The National Association of Community Health Workers, I'm a community health worker as well, and the National Children's Hospitals Associations nationally to address the disparities, the health equity, and mandated compliance in meaningful access to services for our children and families. So through the PEALS project, since we're on the 2nd year going towards our 3rd year, the project we're developing is a training series to educate our families about their federal rights for meaningful language access in healthcare settings and all federally funded entities, actually, because it is in fact an entitlement. So as a linguist, the experiences that I've had, I'm a linguist by trade. I'm master's in foreign language education, whose native language is in Spanish, and residing in the Constitution state of Connecticut. I'm advocating and educating legislators and federally funded agencies like the National Association of Councils on Developmental Disabilities, DDS, the governor's offices, Secretary of State, and news media of language access mandates and civil rights and ADA compliance, because they do intertwine with our communities. So nationally, what I've found recently in this past year and in the territories, there's only there are only 2 model compliance offices dedicated to language access. Those are Hawaii and New York, and thus they provide meaningful access to information in multiple languages, including sign language, because internationally it's not just American Sign Language, as we are led to believe. The only agency in Connecticut, actually, that models a language access plan is our judicial branch through the Supreme Court. Nationally, we have MLAN, which is the National Municipal Language Access Network, consisting of hundreds, I think they're up to 500 at least, hundreds of government and quasi-government agency representatives sharing best practices and tools how to manage this. But many are convinced and mistaken that language is a speaker issue and it's an undocumented issue, and that we should just acclimate just to learn the language and or leave, basically, is what I've heard constantly. So while forgetting that we're on sacred land of Indian natives with several native dialects, and that our founding fathers were fleeing their countries as undocumented immigrants, formerly known as pilgrims. Our leaders from all sides of the aisles are directly, inherently connected to a person whose preferred language was not English, as they are to a person who has a disability. Connecticut's official language remains Algonquin. In fact, we have over 100 different languages in our small, tiny state, but we have over 300,000 residents whose preferred language is not English. Our national constitution has no official language. And I'll get into other issues. If you let me go, I'll ramble on, James.
No, that's a good premise. And I appreciate sort of speaking to kind of your national network connections as well, because I think it's important that our audience understand that we have a variety of folks here, and in one case, Karla with sort of hyper local in terms of the day-to-day work that she's doing, and then the kind of organizational links that you have around the country. And I think it's a great balance. And Irma, Dr. Rosa is probably somewhere in between, because I know she speaks around the country at other organizations as well. But Karla, let me circle back to you, because I want to get from you and Dr. Rosa, since you're on the front line providing the kinds of services you are through your agency, who are the people that what are the populations that you are addressing? Let me start with you, Karla. What communities do they come from? Are they primarily women? Is it primarily children, etc.?
Well, as I said, most of my clients or families, they're from Mexico and Central and South America. And yes, I work more with kids and moms, since early intervention is a program that brings services to kids from newborn up to 3 years old. And then, but we have other services after they pass the age of 3. In early intervention, we also help with transitioning to the public system. So I go to that meeting when they decided to go to the public system, something that you were talking a lot on your previous conversations.
We go to the public school system, is that what you're saying?
Yes.
I see.
Yeah.
Yes.
So yeah, basically moms that usually stay at home all day long because the dad is the one that works all day long. Some of my families, they have like support around in some way, like they have like an aunt or a sister living close, but most of them, they're by themselves, as I am here. So I connect with that too. But yes, I mean, I work with families from Honduras, Guatemala, of course, Mexico, more to the Central and South Mexico. I work with families. I have a beautiful little boy that we do speech services from Puerto Rico, and I love that family. I mean, it's incredible how much they put into helping their kids. I mean, I have learned that there's no excuse, you know? I know that language is a big thing, but there's other ways to communicate too, not just language, right? But I mean, I have a parent that she was from Guatemala, and she was not even like, she didn't speak Spanish well enough, but we were able to communicate, and she was the most amazing caregiver. I mean, all the appointments, all the recommendations, she followed them step by step. So she used to write down all the names of the providers or the specialists, because of course her kid was very compromised. And I mean, it was so incredible for me. That's the passion, and that's the love that pushes you to fight, you know, as a parent.
And when you say she didn't necessarily speak good Spanish, is it because she spoke an indigenous language? Where was it?
Yes, from a small village in Guatemala. So to me, she was a mentor. She was like a teacher. I just like, it's just tells you that, I mean, there's no excuses, right? Sometimes we're like, okay, and I know it's important, the language, and I know it's important to provide interpretation. I mean, that's my job. But at the same time, when you're willing to like help your kid, you know, as a mother, you will do it. I mean, you will find the way. I know it's hard. I mean, myself, that I kind of know English and I'm proud of my accent too. I mean, it was hard to get services through the school system for my own kids, you know, and they knew that I understand very well English, and they knew that I can talk and speak English, but I mean, it's hard. I mean, it's a big change coming from your own countries. You know, this is a different world. And not only my families, but for example, the providers that I work with, I mean, they're so open to learn about the culture, why we do things the way that we do it. I mean, they're always like, Karla, but where is this place from? I mean, and I show them pictures, you know, some of the families that I have, they're from Oaxaca, and they live in paradise. I mean, it's a beautiful place. Like, for example, Puerto Rico is beautiful. It's a paradise. I mean, they move over here because they want to have a better life for themselves and for their kids. So coming from there, I want them to realize that, yes, it's great to be here in the United States, but at the same time, they are leaving everything back. I mean, starting from zero. So just to empathize with that. And they're super open, and they're always like, Karla, thank you for telling me that. I didn't know that. I mean, I'm Mexican, so I'm obsessed with having my kids wearing socks. That was one of the main things that, I mean, all of the providers, especially PT and OT, and they're like, why? They're so obsessed with wearing socks. And I'm like, well, that's how we grow up. I mean, we think that we're going to get sick if we don't put socks on our kids. I mean, things like that, they're simple. And for us, maybe it's like, yeah, I mean, I grew up like that, I understand. But for them, it's like, why? Or why you feed kids? I mean, that's another one that I work with, OT. You guys love to feed their kids until they're so old. They need to practice. They need to, you know, work on their motor skills. And I'm like, okay, just be patient. You know, it takes a little bit for us to understand why. And for me, it's so important for them to know that the people, the therapists, the doctors that I work with, they know about that. They went to school for years, so they're experts. So I'm always starting my conversations with them like, you know, they know what they're doing. That's why we're here. So they feel more comfortable in practicing those recommendations and exercises, because they know that, okay, it's not just a person that is telling me how to do things with my kid. They have facts, and there's like investigations and research behind what they're telling me.
Okay. No, wow, that's really enlightening. That's eye-opening on a lot of different levels. And one of the things that was a thread through what you were just talking about was the cultural nuances, right? So that someone may walk in the door with tremendous amount of training as an occupational therapist or a physical therapist or something, but don't necessarily understand those little nuances, the things that you just mentioned, that make it easier to communicate what they're trying to educate the parents are about, right? I mean, in terms of what they need to know day to day to care for their child. Dr. Rosa, talk about the populations that your organization serves and some of those nuances as well.
Yeah, before I go into that, I want to mention something because I think that when Doris was speaking, there's two things that are really, really important that she mentioned, and we all need to remember. One is that language accessibility is not a favor. Like she said, it's an entitlement. And we, as recipient of services or delivering services, need to understand that. You know, and the other factor that is extremely important, that if you have an accent or if you don't speak a language, that is not a sign of a level of intelligence. You know, and some people immediately think that if you sound this way or you don't speak the language at all, then you are not intelligent enough. And I think that for our families, we need to empower them to know those two factors because they need to fight for what belongs to them. That's extremely important. And sometimes people get shy about that because they feel that they're stepping on, I don't know, in a place that they don't belong, but they should know about that. And thank you, Doris, for mentioning those things because it's extremely important. Regarding the population that we serve, I mean, we're in Central Florida. There's some particular counties that we have extreme large population of Puerto Ricans. And we also have a lot of people recently from Venezuela for obvious reasons. We have some large Haitian population, and those particular individuals, you know, they speak mostly Creole. Then we also need to make those adaptations, not only for the Latino population, but also for the Creole-speaking families. We also have, you know, the Caribbean. We have some Mexican families and Central American. Then it's like a melting pot. And like I say, it's interesting because the language sometimes they mention something that for me as a Puerto Rican means something, and for you as Mexican descendant means something else. Then sometimes we need to translate between Spanish to Spanish. Or what do you mean by that? Or I never heard that
sometimes
word.
Sometimes we get in trouble. We have to be careful. Yeah.
Yes. But that's true. But in general, I think that the way that our agency has been able to deal with all these new opportunities is basically we are the ones that need to change to serve the community. You know, they don't need to learn English. That will be something that they will do if they feel necessary, but we need to accommodate for them. Then some of the things that we have done, obviously, is the translation of materials just to make sure that they have it in their native language. But also when we do tours, if you do tours and you have Anglos and you have Hispanic, is very different to be able to answer questions. And right now, for some particular campuses, we have 8 schools. Some of them we do tours in Spanish, and then the parents know they feel more comfortable with people that are in the same culture. We also try to recruit as many bilingual therapists and teachers that we can, you know, because especially when you are doing diagnostics, you need to provide those services with fidelity. You cannot say that somebody's performing well or not if you are not doing the test the way that it should be done. Then that's something that we take very seriously. And because we don't have that many providers that speak Spanish, you know, especially when you're dealing with a speech, sometimes we need to move those providers from one location to another to be able to suffice that need. But those are the things that agency needs to start to do. And we continue looking for opportunities like how can we cater to this community that is so important to us, you know, and deliver the services that they deserve.
Exactly.
And Dr. Rosa, I try to follow the demographic growth patterns as closely as I can and alluded to a lot of those in the opening presentation yesterday at the conference. I did an introductory report called State of Latinos with Disabilities. But talk about you on the ground, even in Florida, which has long had a a large Latino population. Are the numbers still growing? Are you still dealing with increasing population of either whether it's Puerto Ricans coming from the island or people coming from other countries? Is the Latino population still growing there in Florida?
It's still growing. And for example, we have a massive, immigration when Puerto Rico suffered the Hurricane Maria. That was, I mean, we were not able to deal with that big size of people that came, and process them on a timely manner and start to receive services. And then recently, well, not that recently, but it continues with the Venezuela situation. We have seen that. And the challenges is not only to provide a school or counseling or therapy, is that some of these families, they don't have a job, they don't have where to stay, they don't have transportation. Then we, as an agency, we need to support that too. Then we need to say, these are the agencies that can help you with housing, or these are the agencies that can help you with transportation, because they are lost. They don't know where to start. Then our ultimate goal is that at least when they come to us, we can start to put those things some way in March that they can actually start to build up. Some of our families live in hotels that they pay week by week.
Yeah,
that is their reality.
And affordable housing in general, even for native-born Americans, is a problem. But then you have new arrivals, and then for our audience, the Venezuela population that's been coming recently is because of the political situation. Something like 8 million Venezuelans have left that country. Most of them gone to other countries in South America, but quite a few have come here. I think somewhere in the range of about 800,000 or 1 million have come to the United States. So that's a huge population of people. Doris, listening to the work that they're doing on the ground, as you go to, for instance, some of the national conferences and speak with other organizations, are they aware of these nuances? Are they aware of the kind of frontline issues that Dr. Rosa and Karla are dealing with day to day?
Yes, they are aware. They've been aware, but there's limitations to what they deem possible in addressing certain situations, like the national organizations that I mentioned. Everyone's aware of the situation. It's the availability of resources, the understanding, the education, and actually the actual compliance of the law with the needs of either language or disabilities or health access, or both combined. They are aware. It's some may not be, even if they're 60 years old in federal law and mandates. But for the most part, it's the lack of resources, they say. But there are also, as of 2021, the Biden administration put forth access to funding by health and human services nationally for disabilities and for Latine and for language access to be implemented and further supported. So they're out, the resources are out there.
So there is some funding coming now through the Biden administration to address some of these issues?
It's been out since 2021.
Okay.
And the issue with the application of all of these laws that are 60 years old and then some is the fact that they're not adhered to, and it's not taking the precedence. It's not at the top level of priorities. They're not prioritizing us because we are the low man on the totem pole, although we're 1 in 4 and 1 in 5 nationally.
Yeah, right. 1 in 5 Americans or 1 in 5 people in the United States are now Latino. In our last session, which we spoke about the issue of refugees and disability access, specifically, one of the panelists, Mia Ruble from the Center for American Progress, talked about that there's a variety of laws that do apply that essentially say you have rights as a parent or as an individual with disability. But when I asked her who enforces it, it isn't as if there's enforcement wings necessarily, and often things get changed simply because a parent or an individual has learned what laws apply and asserts themselves and say, hey, under the Americans with Disabilities Act, I'm entitled to this or I'm entitled to that. And you just alluded that to that, Dr. Rosa. When you're talking to families that your organization serves, are they generally aware of their rights, or do they have to be educated about it?
The answer is absolutely not. Most of them, they don't know even their rights. They are afraid to ask for services many times because they don't, it depends where they're coming from. They don't even know that that's something that they can have access to it, and depends of their situation, immigration situation. Some people don't want to stir the pot because they feel that that may be against them. Then that's that fear factor to involve in all these situations. Then one of the issues or, the areas that we address with support is for them to know about these services and the law and what they are entitled, and that there is ADA and there's IEPs and there's systems in place to support them that they can access and they are entitled to. But in general, they are afraid to
And
even ask.
how do you convey that to them? I mean, is there someone on staff that sort of speaks to those issues as part of an orientation, or how does that get conveyed to them?
That's part of when they do the enrollment. That's part of the orientation. And then obviously we look for the Hispanic population. We always have support personnel that will translate if the person in charge, is Anglo and don't speak Spanish. But yeah, that's kind of part of the introduction in terms of, these are the services in the community, and these are this is what the laws say and all that stuff. And for some people, I'm sorry to interrupt, but for some people, they are not even engaged into that. You kind of need to sell that, like, this is important, this is really important for you and your child moving forward.
Yeah, I mean, if you've grown up and a full adult, and even if you have children with these needs, but if you've grown up your entire life not having those rights or anything comparable in particular, it's hard to assert them, of course. Karla, do you find the same thing with the parents that?
Oh, yes. Yeah, the same as Dr. Rosa. I mean, you can even tell the fear on their faces, and it's heartbreaking. I mean, it's just like, come on, no, I'm holding your hand and we're going to do this. Yes, and one of the things that I always try for them to understand is our organization, as well as early intervention or outpatient, the outpatient clinic that I work with, we don't care about your immigration status. We're not sharing, distributing information, private information with anybody. This is for your kid. This is just resources for your family and for that little one that needs therapy. I mean, we don't care. And we always said, if you want to share, we're going to ask questions, because of course, the early intervention services, they're provided at home. That's another thing, so it's very, we getting into their private area, that's hard. So yeah, I always said, look, we're not here to find out anything else. I don't care. We're not here for that reason. So feel comfortable to, like, answer questions. If you're not comfortable saying something, just don't. But yeah.
Do some of the parents, some of the families mistake, if you will, a nonprofit agency, which is really a private agency for all practical purposes, like a United Cerebral Palsy affiliate? Do they sometimes mistake that as part of the government, and then therefore that's why they're concerned?
Oh, yes, 100%. Yes, if they say something, what if I say something and I make mistakes, and then they're gonna call the agency and I'm out of here, and I understand. I understand 100% why they're that way. I mean, they went through things to come over here. I mean, just the journey to get here. I mean, it's incredible. So yeah, I mean, I always say, look, don't worry. I mean, we're not sharing, we're not saying, distributing any information. I mean, we can't do that. Yes, I mean, it's hard. It's heartbreaking seeing those parents, their faces, they're like looking at each other. Should we answer that question? I mean, I'm
So they're
trying to
literally
be-
afraid to kind of punctuate it. They're sometimes literally afraid that if they say the wrong thing, that a government official is going to find out and they're going to be deported.
Oh,
And that-
yes. Sometimes I have conversations with parents, you know, in between visits that we need a signature or something like that. And they're like, but why, Karla? Are you going to kick us out of the service? Maybe I say something wrong? And I'm like, no, calm down. I mean, no. So yeah, they're always thinking they're going to take their services off. I said something wrong, and I always tell my moms, the moms that I work with, I mean, this is what we do, and I'm honest. I mean, there's no tricks here or under things or underline information is here. We're here for services, to give you services. But yeah, it's just
Okay.
part of what we.
James, if I may add to
Go ahead,
that,
Doris. Please.
when we go in at a local level, when I go in as a guardian ad litem to families, and I recently had a situation with a child that was born here, but their parents are undocumented, and they left her here because of her disabilities, and she needs to have services done, and so it's complicated. Because, and as a teacher, I've also had this situation where I speak with my families, and they are fearful, rightfully fearful, and knowing that as an educator, as a teacher, or as a guardian ad litem, I am a mandated reporter. I've also worked for Children's Services and trained. So I am a mandated reporter, but what families don't understand or don't know is that we're not mandated to report whether you're documented or homeless even. We're reporters to make sure that the child is safe, that the family is safe, and the situation that's wrapping around that child, or to provide wraparound services. And our families don't see that. They see it as a threat, and we're taught by nature as Latinos to, you know, keep it within us, and not about us outside. So that's very prevalent in my cases. And also, you know, we know that access to patients and families' preferred languages and HIPAA laws apply. So our families don't realize that health equity, and for our communities that don't speak or understand the intricacies behind the HIPAA laws and the privacy laws, all of that is an issue.
And those HIPAA
Doris,
laws are for that applies to not being able to divulge personal medical information.
Exactly.
Even, I'm sorry, Dr. Rosa, you were going to say.
No, I was going to say, Doris, it's interesting that, you know, we are in a different region and we experience the same things because we are all mandated reporters, obviously, and, you know, in case of abuse or mistreat or whatever, but parents think that we are going to report for something else. You know, they already had that persecution in themselves, and building trust is one of the biggest challenges, you know, and even when we try to put them at ease, it takes a while. And for some people, it's a long time to trust you. First, because they have been betrayed many times, and also because they are in a foreign place, in a foreign language, and they feel intimidated. Then trust takes a while.
Mm-hmm. Mm-hmm.
Dr. Rosa, could you talk a little bit about your affiliate, the UCP affiliate there? Because I know from having interviewed different executives and CEOs from the different affiliates, that every one of them has kind of a different personality and specialization, and some deal with some issues more prevalently than others. Yours runs a lot of schools, and talk about that, and also the special challenges that come with dealing with the populations that you've been describing, right? Those families coming in with children who have disabilities.
Yeah, we do have 8 schools, and 7 of them, I say, mimic each other because they are inclusive programs where you have typical children and children with special needs in the same school, in the same classrooms. The teacher may be dual certified, or we may have 2 teachers, one ESC and one general education. And that's something that we are very passionate about. It. We like to integrate people from the get-go. You know, I think it's so nice when you have two kids and somebody's in a wheelchair and the other one is ambulatory, and they say, oh, what is the difference between you and Johnny? And they say, oh, he likes Superman and I like Batman. And the wheelchair never comes. And it's just
Dr. Rosa,
because
my twins, they went to a program like that. And that
Uh-huh.
was the best thing ever. I have parents right now that they tell me, thank you. So, I mean, my kid learned it so much from your kid too. You know, it's amazing. I'm so happy that you're implementing that from a
Yeah.
parent that went through that.
And the good thing is, like you say, the typical child then understands its sensibilities of being different. That doesn't mean is that you are lower, that, you know, somebody doesn't deserve what you deserve. It's just that there's difference. You have blonde hair and I have dark hair. It's the same thing. Then we are very proud of that, but it took a while for the community to understand that. And I still feel that we need to do more work on that, because a lot of parents that have children, and I'm going to use this term loosely just for the conversation purpose, you know, typical children, they are apprehensive to have their kids in a school with children with special needs. I don't know if I don't know what it is, but they are apprehensive. Then it's a lot of education from our development department and things like that to let them know they're just kids, you know. And they should be integrated, and there's benefit for both groups because each other are going to learn, you know, things, and the ones that we have seen is being so successful, you know. Obviously for parents that have a child with a special needs and a child that doesn't have a special needs, it's also good because they come to the same school and you don't need to be driving them around town. Then I think that particular program has been very successful. The other thing is that we do provide our therapy, you know, we do our IEP therapy because it's a school related, but we also created clinics inside the schools for the parents not to be jumping, like I mentioned before, from one place to another place, but also continuity of services. When you have 4 therapies, you know, and you need to, as a parent, Karla, you probably identify with that. And one say, we're going to do that. And the other one say, we're going to do another stuff. You as a parent get extremely confused on the child too. Then it's good when we have a school-based therapists and medical therapists working together because they communicate for the benefit of that child. Then I do feel that the integration of services is vital, you know, and we need to make the lives of people easier, not more complicated. You know, parents already have a lot in their plates. Like I say, our Hispanic population has more on their plate because of all the other challenges that we mentioned. And we need to look for programs. It doesn't matter what program you do, just to look for what can I do with this program to make their lives easier, you know, and still provide quality services. We do have one school that I just want to mention briefly that it has been interesting because it's our middle and high school. And I'm going to be totally honest, we have not been able to integrate it yet. Middle and high school is a different, it's a different topic.
Special challenges at the middle of high school. I'm sorry, were you going to jump in, Doris, with something else?
Yes, if I can add to Dr. Rosa, those wraparound services. I also have twins with special needs, with extreme disabilities. When they were growing up, they were adopted, and I was a single parent. And so they are 21 years old, and they've moved out. And I'm a medically complex household, so I take in foster children with developmental disabilities, severe disabilities, and now I have a 7-year-old and a 2-year-old, and I'm done with adopting and bringing them home. But then there's the teaching part and there's the advocacy part. What I've always promoted, and I don't understand still, and I'm trying to educate others in nationally and with Family Voices, is the transition. Like we just mentioned, you know, middle school and high school, oof. But there's that transition piece with people with disabilities, children with disabilities. You have a transition into healthcare once you're 18 or 21. And then you have a transition piece in the high school, or in high school, when middle school transition and then high school transition, they don't coincide. We have IEPs and 504s with providers, medical providers that help our children in at home, and then we have providers in the schools and providers outside.
Mhm.
So why don't they communicate? And you add the language also. Why don't they communicate and interact with each other? No, we have to have separate documentation for 1, 2, and 3, and all of that. So they don't provide the wraparound systems, and then our families come in with and these are terms that even a doctor may be conflicted with at times, and an educated or an PhD person, a more educated person is conflicted with and not understanding. And so you bring that all together, and we're leaving our children and our families and communities at a disadvantage. And then these entities don't comply with providing the information, the adequate information and meaningful information in a language that's preferred for the family. And that just creates havoc among our communities.
And
Let me,
go
ahead.
in general, we live in a fragmented system.
Mhm.
It's the truth.
Purposely
Our
at
healthcare
times.
system is fragmented.
Yeah.
Yeah. I want to go back up briefly to Karla. The parents that you've been working with, it sounds as if, aside from the fact that sometimes they're just very nervous about divulging personal information, concerns about who's getting my information or that sort of thing. For the most part, it sounds like they're open to what you and the therapist to go to help them are trying to provide in terms of that information. In other words, they may be coming from communities where there was a lot of stigma or fear, or it was a mystery to them on some level, but it sounds like they're very open to the services that you're providing. Do you find that?
Oh, yes. I mean, in our culture, I mean, we're so used to be fighters. We used to like not have therapy for ourselves. I mean, we grow up with parents that they went through everything and they made it. So of course we're obligated to do that and more, or the expectations are like, I mean, they came from nothing, and now they were able to do all those things. For the families that I work with, I mean, there's no options in their own countries of having therapy at all, So I have to start explaining what's therapy and the benefits, for them to understand, oh, this is something that my kid is going to benefit. And I mean, so I start connecting with my experience, so they feel like, okay, well, this lady understands that part. There's different disabilities too. My kids, they're on the autism spectrum. It's a little different because it's not a physical disability. So you experience other things. But I mean, I start with explaining our program, explaining what therapy is, and starting little by little. I don't like to overwhelm them with a lot of information. I'm trying to be as simple and direct as I can. And also, just to provide them with actual facts of like, if you do this, this is what you're gonna see. For example, I have a lot of families that we get referrals, and when I reach out to them to ask them, hey, to explain the program in general, they don't know why the doctor sent the referral for, like what was the reason. I mean, also they're like, well, the doctor told me to call you, but I don't know what he was like referring me to. That we're going back to what Dr. Rosa and Ms. Maldonado was saying, that there's not a communication there, maybe they didn't have a translator at that time and they just sent the referral. And I mean, so I have to explain the program. I have to try to figure it out more details, because sometimes we get like, oh, this kid needs speech. and it's not speech, you know, at the end it's something else. So I always try for them to understand what's therapy, why we're calling, what this service is going to provide. And they're very receptive. I mean, some of them,
How
they,
do they find out about you?
well,
Is it
most of our referrals, they come from like health providers, would be pediatricians. You know, you go for your annual checkup, you check all the milestones, you do all those things that parents know
okay?
what to do every time that we take our kids to the doctor. But we going back to the health system, right? Some of the clinics that they only have Spanish speakers, providers, they're overwork and overload, right? So they're trying to help out a lot of families and they just send referrals here and there. So sometimes we have to start from zero, okay? So, okay, is this for speech, for OT? What are your concerns? I have parents that they're like, no, I mean, I remember this very specific at this family that I was like, you have any concerns, Mom? Tell me about. No, not really. I mean, I think he's just little. He's gonna catch up, you know. And I mean, the kid was like 13 months old and he was not able to stand up or sit.
Right.
So
That's
there's a lot of information, you know, we trying always to tell parents about kids development, you know, what your kid should be doing at this month. I mean, it's like little steps, right? So of course I'm not gonna overwhelm the mom and say, oh my goodness, what? Like, it's just like, okay, you know what? If you want to, we can evaluate him, you know, you don't lose anything. Actually, the evaluation can be here at the clinic. I mean, let me send you the address. I mean, try to help out, right? The same with my excellent providers. I mean, I work a lot with Dr. Cheryl Ramos. She's a PT and she's so good. She has so much experience dealing with parents like this and kids that she's very like that. She teach me how to approach parents in a more gentle and, you know, just a little bit information here, a little bit information there, just for them to be open to services. Because sometimes, as we mentioned, we have kids that they reserve every single service, speech, OT, PT, you know, it's a lot. And some of those parents, they don't have the ability to have transportation. So that's why early intervention is so important for our community, because the early that we start, it's not that we're not going to see benefits at like if they're older, but I mean their brains and bodies, their development, and we need to start early. So yes.
There was a question earlier that rang a bell for me. It was a question about what about the immigration status of these folks, and we've spoken a little bit about that already. But in the opening presentation that I had yesterday, I allude to something called the quadruple challenge, and so that there's kind of sometimes layers to the populations that you're trying to help, right? It may be that it may be a language barrier, that may be one thing, but they may be dealing with just institutionalized racism. They may be dealing with immigration status. They may be dealing with being low income, which brings its own issues along that sometimes maybe means a less of an educational foundation, and then the disability itself. And so these are kind of layered things, and it sounds like that all of you on some level are having to deal with all of those things simultaneously, at least with a certain segment of your population. Obviously, most Latinos in the U.S. are U.S. born, and
James, if I can add our environmental scan, the data portion for all the data lovers out there, which you are one of them, I see as well. So our environmental scan, which is going to touch on what we were just speaking of, more than 80% of families know that they can request interpretation and translation, but just over half know that they can file a complaint when they are denied interpretive services. And only about half of the people believe that their healthcare providers know about and respect their language access rights. So you have those statistics, you have that data. Well, if they know their rights, why aren't they? Well, there's those layers. And I've worked with immensely with child protective services. If there's an issue or concern and a provider is thinking, okay, they're not reaching their goals, or they're not their milestones, and they're delayed, or maybe it's because this is a marginalized community, or maybe it's because it's abuse and neglect. So those are mandated reporters thinking, not seeing, but thinking they're doing the right thing, and throwing at the hands of the state, which sometimes isn't necessary. And there's been a large movement nationally for promotoras and community health workers who we are in the communities. We know and live and breathe the communities and our heritage. So we need to be those trusted messengers, as Dr. Rosa mentioned before. There are trusted messengers, and the faith-based communities, which we haven't touched on. That also, it comes with stigma. The faith comes with stigma also, but those trusted messengers in those faith-based communities are essential too, with the language access portion.
There's an extreme example, and I want to lay that out up front. There was an extreme example that I heard about a number of months ago. There was a White House panel discussion on African Americans with disabilities, leaders in the community. And one of them was an individual who's doing a lot of prison reform work. And his situation was that he had autism, has autism, and was out in public one day and was having some kind of an episode, and the police mistook him for just being a violent, hostile person, and threw him in prison. Convicted him of assaulting officers, threw him in prison. He was there for 2 or 3 years. Finally, somebody got him out and explained to them the person was just having an episode. And so that's an extreme example, but I imagine that what you're alluding to in part, Doris, is that sometimes someone is developmentally delayed and it's a child and they're young, and someone may come along and misinterpret that as, oh, this is a child who's abused. Do you find that, Karla? Have you seen any examples?
Oh, yes, 100%. I mean,
that's a little frightening.
it is. I mean, we have families that they live not even in trailers. It's just a little van. It's just, it touches every five in yourself. You have to be very careful and very thoughtful about every single situation. You cannot treat everybody the same. Yes, it's challenging. And I'm so thankful that the UCP here in Huntsville, and I mean the therapists that I work with, they're so willing to understand that too. As we said, we're obligated to say when like someone is abusing someone else. We're obligated to do that, but at the same time, we have to also see and check the families as individuals. I have family, most of my moms, they don't pass the age of like 20. I mean, several of my moms, they're like 18 or younger.
The younger moms. Okay.
Yes.
Yeah.
So
have less experience in general anyway.
So, I mean, they're trying their best, but I mean, it's a baby taking care of another baby in living in this country. I mean, yes, you have to consider a lot of aspects in order to make a decision. I mean, I'm not saying that, I mean, the rules are the rules, the law is the law, but at the same time, I believe since I step in, we're more conscious about every single situation, like
yeah. I think it's also again our own sort of cultural upbringing here in the United States. If you were born and raised here or lived here for a long time, you have certain expectations about what you think parents are supposed to provide for children. And I've visited Latin America and rural regions, for instance, of Mexico, and found extremely loving families in small huts on the side of a mountain with no floors. does it mean that they don't love their children? No, that's their condition. That's where they're living, right? And that's where they're raising their children. And I think, that those are, somewhat extreme, but I think that's part of the conversation here. Understanding where people are coming from, right? As well.
James, if we add to that context, because I've been subject to this personally, when you're a parent with disabilities,
Okay.
that turns it up a notch. When you're a parent with disabilities with communication challenges, that turns it up another notch. I've had social services come. I've called social services to come to my house. And I've had social services come because an administrator or a teacher or social worker thought that I wasn't doing my job, and maybe mom is too stressed out or has too many disabilities that she's not able to. And I do what I do. So I've worked with communities and parents that do have IDD and do have physical and invisible disabilities. And they fear, not only do they fear because of their status as with language speaking or as immigrants, on top of that, the burden of being disabled, parenting while disabled is another layer that's not usually addressed. There are many of us out there, and we have coalitions and such. We have rights and such. Nationally, we get together, but that's prevalent among people with disabilities and language issues and being parents.
Yeah, we've got just about 2 minutes and then we have to end. But Dr. Rosa, any closing thoughts in terms of things that people should be particularly aware of when we talk about language accessibility, children with disabilities, populations that you deal?
I do think that I echo what you guys say. We need to stop being so judgmental, because your reality, my reality is not the same. And that doesn't mean that one is better than the other. Like your example, James, about what you have been facing, what you saw, that doesn't mean that they were bad parents. That's probably the most that they have been able to do at this very moment. And something that Karla mentioned about younger parents, we house within one of our schools a program that is for teenagers mom. And we have moms as young as 12 years old. That is a baby, having a baby. And, typically those kids are going to have some kind of issues, the baby, because it's coming from somebody that maybe did not have prenatal care or all that stuff. Then the whole thing is complicated, but I feel very optimistic that if we have an open mind, we will be able to support others in need. It's just that we need to take that preconceived ideas of how things should look.
Yeah, and that goes to the kind of the cultural competency question, right? Being trained on some level to be open to the fact that this is a completely different culture. We're providing services for them, and so we need to kind of come from their point of view. On
Absolutely.
Yeah. Any closing thoughts, Karla? 30 seconds or so, just some final thoughts on what you'd like our audience to take away in terms of.
Well, that I want them to know that they're not alone, that we care, and you guys are being seen and heard. And I mean, we're working so hard for everybody to understand that you guys have rights. And oh, my kids are here.
Okay.
But yes,
Perfect timing.
we're
Perfect
working.
timing, actually.
Oh my goodness, Abigail. As I said, as an immigrant and girl here. Oh no, Abigail, give me a minute. It's me that I have to take care of my kids and everything.
That's okay.
But thank you so much. I have learned so much from this amazing Dr. Rosa and Ms. Maldonado. I mean, it opened my eyes to do my job better. And I appreciate having this opportunity for me to express what's going on here in my little town of Huntsville, Alabama.
That's good.
Thank
So
you
you have two accents, by the way, so that's great.
Yes.
Doris,
I'm trying to blend into the society here.
And I think your
Both
kids
ways.
arriving right now was perfect. It puts the perfect cap on the whole discussion. But Doris, if you could just in a minute close out for us, final thoughts.
Sure. Please, anyone who's experienced or witnessed language access discrimination on behalf of themselves or another person, know that you're entitled to file a complaint within 180 days of the occurrence. Please educate legislators that ask for your vote and pledge to be your voice to protect your civil right in the pursuit of happiness. Educate your providers and join National Family Services Voices, family to family. We're in statute, we're national, and in the territories, it's free, no obligations. Involve your youth. Make sure that your children, my children have been attending their IEPs and their 504 since they were in kindergarten. With a communication challenge or not, they need to be there and need to learn how to advocate for themselves. And find a mentor. We're out there, even if it's nationally, we're out there. Thank you for everything that you do. Thank you, James.
All right, thank you so much, Doris Maldonado,
Thank
Dr. Irma Rosa, and
Thank
Karla
you.
Greene. Thank you so much. And thank you to our audience for sticking with us. I know on the East Coast, it's probably getting a little bit late in the day. We'll be back tomorrow with the final day of the conference, 2 sessions, beginning at 1 p.m. Eastern. And if you're an attendee through Eventbrite, you'll just log in through the same link that you have. Thank you so much. Have a great day, everyone.
Thank you. Where's Penny? She's in the back.